Hello, my name is Kim Gardner and I'm the operational sister here in the NIHR Clinical Research Facility at Great Ormond Street Hospital. Today I'm going to take you on a virtual tour of our department, talk about some of the staff roles, both clinical and non-clinical, and how the teams work in different ways to support research across the hospital, share some thoughts about what research means for staff, parents and children, and then lastly, we'll take a look at playing the CRF. As you enter the CRF, you walk through the open play area, which is based on the woodland theme. Walking beyond the play area is the main reception, which is usually the hub of activity for both staff and families. Beyond the reception area is where the main clinical activity happens. Each of our individual clinical rooms continue the woodland theme and are named after trees, namely being maple, ash, willow, chestnut, pine, elm, holly and oak. Each room is flexible for either a bed or a treatment chair, depending on the study needs and also patient needs and preferences. Two of our rooms, Maple and Ash, have an interconnecting door, which is invaluable for siblings on the same trial or when we just need that extra bit of space for study-related equipment. Although most of our work is during core hours between Monday to Friday, where there's a study requirement, say for example, specific post-dose observation or for PKs, that we are able to support overnight stays within the department. And when there is a need for short-term weekend study cover, we also factor this into our rotas. Taking a look at our clinical delivery team, you'll see the team is led by our head of nursing and two matrons supporting the research nursing teams within the wider trust. The NIHR CRF team comprises of an advanced nurse practitioner who, if you haven't heard about her role already as an AMP within the research at GOSH, you'll certainly hear about it later. We have 7 senior research nurses, one of whom is also a trainee neuromuscular AMP. We have 20 research nurses, 3 assistant research practitioners, 3 healthcare assistants, 2 apprentice nurse associates who will soon be qualifying and coming back to work as nurse associates with us, and a practice educator who has an overarching role across the whole of the R&I Directorate for Education. So how do we work as a team in the CRF? The CRF clinical team is split into smaller teams, each led by 2 to 3 senior research nurses who have oversight of all the studies within the teams. Each of our research nurses leads on up to 8 studies currently and in various stages from setup, recruiting, follow up through to those waiting closure and archiving. Teams then work to cross-cover each other where necessary. Our non-registered nurse team members are able to support these studies or by running visits independently on the trial. There are many studies such as registries and BRC projects that they also lead on with the support and oversight of a research nurse. Those teams working across the wider trust are the bone marrow transplant research nurses, haematology oncology research nurses, also supported by an advanced nurse practitioner, the PICU research nurses, and if you haven't heard about those, you'll hear about their amazing work later too. We have gene therapy research nurses and also a team of nurses that look at cardiac and pulmonary hypertension. We are lucky enough to have a research transition senior nurse who works between our division and the team in the wider trust to ensure that later phase trials can move and run into the clinical service. The transition research nurse also ensures a seamless transition into the clinical service when trials are coming to an end and are licensed or authorised for compassionate use, such as binuria used in the treatment of Batten's disease. Our non-clinical team, having spoken about the clinical roles within the Research and Innovation Division at Great Ormond Street, which make up a team of about 50, there are approximately 40 members of the non-clinical delivery team, some of whom are based at the Research and Development Department in UCL. The non-clinical part of the team has developed over recent years as our research activity has increased. Roles within this non-clinical team include senior research coordinators, data managers, operational manager, clinical research delivery managers, and portfolio managers. The list is endless and the roles are evolving regularly. As with the clinical team, the non-clinical team are also aligned with different speciality teams across the trust. They are an integral part of the team to ensure that collectively we provide a seamless service. Those others that are equally important within the R&D team are the head of governance, clinical trials and contracts, quality manager, governance, and there are also many more. So thinking about the types of research that we do, we support all types of research from novel therapy, first in humans, stem cell therapy, early phase trials, plus those later phase trials that due to the nature and intensity of the study complexities or the disease process cannot be run within the clinical services. We also take part in many natural history studies that lead on to new and innovative therapies from this stage. Some of our novel and first in human studies include enzyme replacement therapy for some neurometabolic disorders, where the ERT is infused directly into the cerebellum by an intracerebral device. Therapies that replace the exon skipping in Duchenne muscular dystrophy. Gene and stem cell therapy for babies and children with spinal muscular atrophy. We also support numerous clinical trials within the clinical setting where a child is acutely unwell or a prolonged stay is required. So thinking about research and what research means to you was a question that we asked some of our families. The commitment from our families to all of the trials is phenomenal, and many are attending weekly or several times in a 2 to 3 month period. And although we ask feedback at each visit, both what went well today, could we have done better to improve or maintain our service standards, we don't always capture their thoughts and feelings about taking part in research. So for this, we asked those who were willing to answer, what does being part of a clinical trial mean to you? So some of the answers are on the slide there, but some of the other parts were meeting others with the same condition, being part of something. I personally like the one that says hope. It helped him a lot. He has some movement in his fingers and reduced use of BiPAP, which he now only needs at night. Another parent has said it's an opportunity to address the long-term rare medical conditions that can benefit others in the future. And specifically from the young people, a young man has just told me this morning, my lifestyle has improved. He also added, I'm able to do so much more than I did, and I feel that I was lucky enough to be part of this trial. Another young person said, helping people making a difference in the world, but also being able to research life-saving medication thoroughly with the best care and attention. For me, it was very interesting that none of them put anything about the level of commitment needed from them or any of the extra stresses that it may cause their siblings or other family members. Each one was solely about gaining something from the individual trials. So I asked about the impact of having a child on a complex clinical trial and what it had on the families. And each family's response was similar to that they would do anything for their child. The smallest of hope was enough. To most of the siblings, the trial days were just another hospital appointment, and they were used to that anyway. Almost had really good supportive networks prior to coming onto the research trial, so they were able to use those. For one young person, he said the impact of being on the trial was positive for his family, as his long-term condition had improved so much and attending the CRF was far less intrusive than being unwell and unable to attend school and see his friends. And when we were thinking about what does research mean for staff, there's a few of the words up on the screen there, but opening up potential opportunities for children with long-term conditions that aren't currently available within standard clinical care was one that came through strongly. A sense of hope that it offers patients and families living with rare conditions. It allows us to be more informed about various conditions and develop treatment that to support and prevent any disease progression. When a drug gets licensed, knowing that I've been involved in that trial since the setup, and I love getting to know the families. It's been a privilege to be involved in such groundbreaking innovation. It's exciting and rewarding, as it says there. Testing boundaries, discovering and thinking outside the box, and stepping into the unknown. I think they're all quite powerful experiences of what research means to both families and to the staff. But lastly, I just wanted to touch on play in the CRF and what it means for us here. As you may have seen on our virtual tour, as we entered the CRF, the play area was unfortunately devoid of any available toys. This is due to trust guidance in the current COVID-19 restrictions that we are all under. Our amazing play specialist, Amanda, has created individual play boxes for our regular attenders and offers activities at a reduced selection for others when they arrive. And I've just put out a selection of them there so we can show you. All of our toys used for distraction come individually wrapped, and the children are free to take them home afterwards. So at least we have something. We don't have the regular amount of toys that we would normally have that are free and easy to play with. Our hospital play specialist role is invaluable within research in helping children talk through and understand the clinical trials in terms of what's involved, commitment needed, procedures involved, and working with them to overcome their fears and anxieties they may have. I hope you've enjoyed our short tour of the CRF and a short review of our services. Thank you for listening.